Thanks everyone. Welcome to RMA 19. My name's Adam Coltzau and I'm the President of the RDAA. Well, for the next 28 hours or so. I'm not counting. I haven't got it down to 28 hours and 46 minutes yet. It's getting closer though. Before I start, I'd like to acknowledge the traditional owners of the land at which we meet, the Yungabar people, and pay my respects to their elders past, present and emerging. When we meet at RMA, we don't just do a regular acknowledgement of country, and that's because many of the delegates in the room are Aboriginal and Torres Strait Islander people, and I'd particularly like to pay acknowledgement and respect to them for being here, being an important part of our conference, with their stories, experience and knowledge which has been shared with us in the past. They're an essential part of the program and I'd really make a particularly special acknowledgement to them. I acknowledge our guests which will welcome us to country very soon, and to our Chinese delegation for joining us today. We've got lots of indignitaries with us over the next few days, including the Queensland Health Minister, and I see my colleague Paul Worley down the front, the National Rural Health Commissioner. Welcome, Paul. We'll also have Mike Colton and Chris Bowen, all coming to our conference, the leading rural conference in Australia by far. And this year, of course, breaks all records. We broke a record last year in Darwin, and we didn't know that we'd be able to break another record again. Latest numbers are around 980, so just shy of that 1,000 mark. Hopefully we can get some single-day delegates in between. I'd like to thank and acknowledge the RMA Steering Committee led by Dr. Sue Maisel, the ACRRRM and RDAA teams that have created a great program over the next 3 days. Of course, this wouldn't be possible without our sponsors, and in particular our platinum partners Queensland Health, as well as many of our other sponsors, including JCU and Digital Health Agency of Australia. Please take the time to visit our partners and sponsors at the conference and trade booths. Without their support, this conference is not possible. Right, well, it's been 2 years since I've become President, and it's been 12 months since I last spoke to you. And in that time, as a rural doctors advocacy group, the RDAA has been very busy, and government's responded quite well to our ongoing discussions. Of course, we've had an election, if no one noticed. Election time is a very difficult and busy time for a lobby group, with our staff putting in enormous effort to push for changes to rural health, to improve health of rural communities right across Australia. We saw the $62.2 million announcement in the May budget for the kickstart of the National Rural Generalist Pathway, $30 million in the December mid-year economic review for GP to patient telehealth item numbers for our most rural and remote parts of Australia in MMM 6 and 7. They will come online in just over a week on the 1st of November. This is a result of significant action by ACRRRM and RDAA and a joint submission on telehealth to the Minister, with significant follow-up lobbying about the importance of access to patients right across drought-ridden parts of Australia. The Minister listened. We didn't quite get what we wanted, but we've got the start, and that's how RDAA gets stuff done. We come with solutions. There's still a lot of work to be done, and we will continue to lobby on issues around workforce shortage, GP registrar training numbers. We will continue to push strong with all levels of government to improve rural workforce and access for rural patients. Of course, this must always be balanced by the need to tell everyone how wonderful our job is in rural Australia. And as I stand here preaching to the converted, I want you to remember that part of our job is to try and encourage younger people to come through and enjoy the life we live in rural Australia. Rural medicine is a fantastic career, and it's important to try and share that. We were given the opportunity to try and share that this year with our Destination Rural campaign, to promote rural careers and rural lifestyle, and show some of the good stuff about what a wonderful career rural medicine is. From an RDAA perspective, we've continued to get very good engagement with our politicians. We're getting good media coverage. We've lifted the profile of rural medicine as much as possible and continue to strive for not only rural doctors, but rural patients and rural communities. One good example of this is over the last 3 years, the RDAA has worked with the National Farmers Federation to give a medical voice to the National Farmers Federation calls for mandatory operator protection devices fitted to all quad bikes. Earlier this month, that legislation passed through Parliament, and we continue to lobby at state level for mandated helmets and to ensure that operators under 16 aren't riding these devices. Our voice is a small one compared to many other larger medical organisations, but it's an important voice, and it's a voice that's listened to. And we will continue to strive to strengthen rural health going forward. We will continue to advocate strongly for our patients, for those who don't have a strong voice, who are too busy each day in their consult rooms. The RDAA will continue to strive to have that voice heard at all levels of government. The strength of our organisation comes from its solutions base. We come to government with a solution. We don't just come and whinge. That's what sets us apart from other organisations. We do things differently. We do it the way we do it in rural medicine. We think outside the box and come up with a solution that doesn't just always involve more money. The other part of our strength, of course, comes from our membership. Strength comes with numbers. To all of you who are members, thank you for your contribution to helping us do the job we need to do. If you're not a member, please consider joining. Take the time during conference to talk to members of the RDAA, come and visit our booth, find out what we can do for you individually, but also find out how you can help better rural Australia. On behalf of RDAA, I wish you all an enjoyable conference. Please make the most of our trade displays and our educational activities. Help make our conference great. Visit us on social media. Use the conference app, and most of all, enjoy this special networking time to mix with colleagues, to show support and fellowship. Thank you very much. Welcome to conference.